Couple questions?
Nursing homes in Connecticut. What's planned for the rollout for the remainder of the nursing homes in Connecticut, and how long do we expect the entire population to be vaccinated?
So the Fed's Operation Warp Speed will determine, they determine this nursing home, other nursing homes, how's it rolled out. And I think you're going to see every nursing home and all of our frontline healthcare responders at the hospitals with their second vaccine by the end of January.
The consent forms are another part of this process, getting those residents to sign off on them, maybe convincing some of their family members to sign off for them if they're not able to do so. Where are we at with those consent forms? Do we have a good idea of how many residents are on board with the vaccine?
You should probably ask Rich. He just told me that everybody wants to get vaccinated. They're looking forward to this, and I don't think getting the consent forms is going to be a big issue.
And as far as, I think it takes, 2 weeks for our bodies to really respond to the vaccine. I guess potentially we could be looking at some really hopeful, positive numbers for the end of January as far as seeing those numbers go up and up like we were seeing, eventually coming down.
No, you're right. If we can, hopefully you'll see fatalities. That curve starts bending. You know, we bend a little bit just by PPE and inspections here at the nursing homes. And I think, just as importantly, less people with complications, less people in the hospitals, keeping capacity in our hospitals, that's pretty important as well.
Governor, we heard from a viewer who asked what the availability of the vaccine will mean for folks who have already had the coronavirus. Do they move to the front of the line? When do they kind of fit into this equation?
I would think if they already have the antibodies, they would not be at the front of the line. Beyond that, let me get back to you.
What about you? When do you think you'll get vaccinated? Will you do it publicly?
I would definitely do it publicly, and I'm going to wait for Deirdre Gifford to tell me when's my appropriate time to do it.
Can you talk about your discussions with other states and how you're taking a regional approach throughout this, Massachusetts, New York, Rhode Island? Everyone now is at the same level trying to do the same thing, and yet travel restrictions. So what kind of ongoing conversations as far as getting the vaccines out? Is there a coordinated approach, or each state for itself?
We're sort of on our own, aren't we, on the vaccinations? Are you coordinating, Deirdre?
Well, so CDC is giving us, will be giving us more advice. They've started already, but they'll be giving us advice in terms of prioritization. And the governor's advisory group will then be looking at that CDC advice and advising the governor in terms of the next phases of the rollout. I imagine that most states will follow more or less what CDC puts out. It'll be very useful to have that national guidance.
And Governor, you've mentioned that you want to hold off on getting a vaccine. I think Vice President Pence is today. Do you feel that that's the wrong thing to do and that you should wait your turn?
As I said, I had a bit of a quandary. I want to lead by example, just like the amazing people here are trying to give people confidence within the Reservoir Nursing Home that it's a safe thing to do. So I'm going to probably defer that decision to public health.
Are you going to do it publicly?
Yes, I think that would be appropriate. Indoors.
Does the state know, has every nursing home in the state partnered with either CVS or Walgreens to roll out?
Yes, they have.
That's a yes.
Yes.
Governor, your holiday message to the men and women in nursing homes across the state of Connecticut who have had just an awful run, many of them, loneliness, isolation. I know we've done the best we can, but what do you want them to know as we go into Christmas week?
I want them to know it's going to take a little bit longer. They're going to have to stay here at the nursing home. But we have a vaccine. That's the vial of hope. And within a month or so, once that second vaccine is done, you'll be able to celebrate a really beautiful holiday with your family.
How long will it take to get to all the nursing homes in Connecticut?
I think we hope to get that done by the end of January.
That's not bad. A couple weeks. The first dose or all doses?
All doses.
We've heard people like the fellow who was chatting a little bit before. There are a lot of people who might still be hesitant or have any reservations about the vaccine. How are you going to work with them to show them that this is being safe and effective vaccine?
Well, Deirdre and Reg Eady, who runs Trinity, Hospital have got together a vaccine board. One of the things they're doing is they represent the community. These are they're religious leaders, labor leaders, political leaders that get into the community. But to be blunt, I think for the next few months, demand is going to outstrip supply. We're working hard to get as much supply as we can because people want it. And I'd like to think that over the next few months, you're going to have a friend, a family, a neighbor. You'll see people getting vaccinated. You're going to feel more confident. I'd like to think Connecticut's filled with smart people, and overwhelmingly they're going to get vaccinated. Thanks, everybody.